Hi, I'm Rebecca Gordon.
I am Sylvia Gordon.
And on this week's edition of the Sisters of Selling, we're going to give you some fun facts to make sure that your website, your Medicare website, is compliant going into 2024.
Because we have the most new CMS regs that we've had in like 15 years. So a lot of stuff besides the one or two things you probably think you have to do.
Okay, so add to your website. You got to have a Medicare disclaimer. Here it is, plans, blah, blah. The thing you have to know, it has to be in at least 12-point font. So there's a couple other new regs that we're going to talk about that have to be on your website, but it doesn't specify the font.
So what people have done in the past, they've had to have disclaimers. They put it white on white, so you can't see it, but a computer can see it, and they can say it's legally there. Or they made it a size 3. We've hated that. That's useless, and that's insulting. So the government has to come out and specify size, location, font, which they did not do for every disclaimer that we have to add.
Right.
But they did for that one. This is a new one. You have to have an opt-out form that you can hand out, mail out, have on your website for your clients to opt out of further communications from you. It is a CMS-approved form that does not exist yet. We don't have it, but the law says we have to give it to them. So we don't know when it's coming, but it is coming, so just make a note of that. Yeah.
I don't like this one at all. I think this...
Well, and then everybody says, well, if you're my client and I want to talk to you about your SilverScript Part D plan I sold you, I can still call you about that. The opt-out is saying I can't call you about final expense, life, annuities,
anything
ACA,
else.
That I can't...
That could be new and really a good option for your client.
But that's only if they did opt out. Right now, I'm just saying, by law, you have to furnish them an opt-out opportunity, which we can't help you with.
All right. If you have any of these Medicare cards on your website, get them off.
And a lot of you do. A lot of you haven't looked at your website in years. Somebody built it for you, and you approved it, and you don't go check it out.
Right.
You don't
move on.
Yeah. So a lot of you have to go
get that
check
off.
your website, get that off.
And when does this stuff have to be done?
September 30th.
September 30th. So, all right. You must put on your website that you don't offer every plan in your area. Contact Medicare.gov. We don't know where this has to go, but it's supposed to be on your website.
Best practice, put it on your front page footer. But if you are like, well, I'm going to put it on the last page of my 50-page website, that's still, as of this point, that's still compliant. Remember, just because you're a little agent and you're like, they're not going to worry about me.
There's lots of programs out there that insurance companies hire to crawl your website. They'll do it. They'll call us. We have to call you. So get ahead of it.
So remember, if it did detail on a disclaimer, the size, location, the font, we're telling you. So if it didn't, because we don't know yet.
Whatever you want. Don't get nervous or start sweating. This is a time of year where everything starts getting very hectic and stressful. Do the best you can. We want you to get this stuff on so that you are in good shape, but there aren't any penalties right now. So we're just letting you know, get ahead of it, get on it. If we can be of any help, those people that we do their websites for, there's about 25 to 50 of you that we run your websites. We've already made these changes.
We've already added the disclaimers, and we didn't add the Medicare card to begin with. You must display on your website, again, that was the prior disclaimer. Plans are insured by a Medicare organization. We are not part of the government, blah, blah, blah. So that's 2 that you can hook together to put on your website. It's going to be a total of 3. And then if you collect any information off your website, you have to add this separate disclaimer under where you would collect it.
So like if you had on your website, contact me to book an appointment, and I give them my zip code and my phone number.
Or get a quote. It has to say underneath there, by submitting this information, you're going to be contacted by an agent for, this is a solicitation of insurance. You got to have it right there, right, not somewhere else, right there where you're trying to collect that client information.
So what's wrong with this? Why can't you have this statement on your website? We specialize in insurance for seniors in your town.
So in the Medicare marketing guidelines for this year, they said that seniors is not inclusive enough. Don't use seniors. If you have seniors on your website, you have a problem. Go fix it. It needs to say
retirees,
or it needs to say seniors and those under 65 eligible for Medicare due to disability. So they're saying seniors doesn't encompass everybody that's eligible for Medicare because of the young people on disability. Again, like Rebecca said, use retirees. That's still okay. We don't work with this company, Medicare FAQ. They're a large call center. Super shout out to them. They're awesome. But they have already gone ahead and put the disclaimer under their name because they have Medicare in their name.
So if you have Medicare in your name, it has to say a non-government entity.
Or it could alternatively say,
not affiliated with the government.
But you need to put it directly below your logo. And most people haven't done anything. This whole thing that your name could be misleading.
Yeah.
We've all waited. Aetna, Humana, United Healthcare. Well, everybody's asked CMS for further clarification if you can use Medicare in your name or your DBA.
It'll be interesting because these standalone stores,
which I don't know if we have
Medicare stores,
I don't know if we have a picture of them on here.
You know, you've seen them. All of a sudden, are they pulling out their sticky letters and writing a non-government entity under them?
My supposition is that we're going to get through this AEP, and then CMS is going to clarify it next year. But that's just my guess.
I don't know.
And they could clarify it today at 3 o'clock. I mean, every day they can just pop something out.
This is something new. You can't have Med Subs and Med Advantage on the same page on your website. They have to be completely separate. And a lot of people list it.
They spreadsheet it.
Because it's kind of nice. This has this doesn't, this has, to just kind of as a guide.
So it's very common that you're going to have that on your website. Like you're getting ready to retire. You have 2 ways to go. There's a fork in the road. Go to Medicare supplements. Here how that works. Here's how Med Advantage works. No, because the government said they're not apples to apples. Medicare supplements original Medicare. Medicare Advantage is private Medicare. So it'd be apples to apples if we had like a hospital indemnity versus a Med Sup, So they're saying don't confuse the public. Take them off of the same website. Again, just more work for your nephew or whoever updates your website.
It's just like, okay.
And then a lot of people are confused because like Aetna told me this, Cigna told me that. Humana said this, but Anthem didn't say anything. And I asked United, but they didn't respond.
It's just kind of free-for-all right now of just knowing exactly.
That's common.
What you have to do. But these things you have to do by September 30th.
Yeah, everything up there is already locked down. The only thing that's not locked down is do you have to take Medicare out of your name or your DBA? And the rule, as it's written, says if it's misleading.
Right.
So,
and who determines what's misleading?
So right now, that's a gray area. So everybody that I've talked to that has Medicare in their name or their DBA, I said, do you have your Plan B ready? Did you file another corporation, or do you have so that because if it comes down today at 3 o'clock, you got to do it today at 3 o'clock. You got to.
And hopefully you do have a Plan B because we've only been talking about this
since May.
If not before. I swear we've been talking about this for a month, like a long
time.
Right. So we've done our job.
If you have questions, hit us up in the comments. Ask your marketer. And again, this is a evolving situation. We'll keep you updated.
Have a great day. Good selling.